Hi everyone, my name is Gerald Luande. I'm the co-founder of Precise Genomics and Uhai. Uhai is a health system strengthening application that supports the blood value chain.
Innocent Daga, I'm a professor of microscopic anatomy and embryology.
Hello guys, my name is Benjamin Maguso. I'm a medical student at Moi University College of Health Sciences. I am the Chief Operations Officer for Uhai at Precise Genomics.
Okay, my name is Stephanie Chebet Kitur. I'm a fifth-year medical student and the Chief Partnership and Marketing Officer for Uhai.
I am an associate at Royal University, and currently I'm the customer experience officer at Uhai.
The problem that drove my team and I to start Uhai was the Auditor General's report in Kenya of 2022 that realized that our blood banks get less than 30% of their target volumes. Much of the blood donated is wasted due to poor cold chain management and processing. And lastly, patients don't get their target requirements of blood. This causes a huge risk of our patients losing their lives in critical conditions.
In my practice as a medical student, I've experienced and witnessed a lot of patients losing their lives due to lack of blood and blood products.
So in a country where about 7 Kenyans require blood transfusion every 10 minutes, every single unit collected counts. And as of today, only about 95,000 of the required 475,000 units required yearly have been collected. The situation is exacerbated by challenges in blood supply and blood supply chain management and distribution.
Uhai is a platform that leverages technology to be able to provide improvements in access, processing and distribution of blood and blood products.
Uhai proposes to create an all-in-one app that addresses 3 major challenges in the blood supply chain. That is access to donated blood, processing of this donated blood, including cold storage, and lastly, distribution of this blood to the target patient.
Uhai plans to strengthen blood supply chain by investing in access, in processing, and in distribution. By creating an inventory system, Uhai's initiative will ensure that there's no wastage of the limited blood sources that are already available.
Key features of a smart notification system, as well as behavioral modification through digital badges. This ensures a constant supply of blood.
So Uhai is using proprietary algorithms because it's leveraging on artificial intelligence and machine learning to identify the behavior patterns of our potential donors so that we can know how can we incentivize them to donate more.
Under processing, we have developed innovative temperature monitoring systems to ensure the cold chain is maintained throughout the entire blood donation process.
We'll be able to use temperature monitoring systems to alert the blood bank staff whenever the cold chain management system is interfered with. Lastly, we will create a portal that allows patients to directly request for blood.
Pillar of distribution, we have developed an innovative requisition system and inventory management system that ensures blood gets to the patients who need the most without bias.
Customer segments in this app will the donors, 2, the blood banks who are processing the blood, 3, the healthcare facilities in need of this blood, and finally, the ultimate consumer of the blood, who is the patient.
Ultimately, our goal is to minimize wastages, improve donor retention, and improve the blood supply, reach national and regional targets, and also to ensure adequate distribution to the patients who need it the most and without bias.
Hi, our pathway to market success is 4 weeks after incubation. We are developing our minimum viable product. 6 weeks after incubation, we are onboarding our partners, which include the hospitals, donors, and Kenya Blood Transfusion and the Regional Blood Transfusion Center. 8 weeks after incubation, we are doing our pilot testing. And finally, 10 weeks after incubation, we are submitting our product to the regulatory authorities, which include Kenya Tissue Transplant Authority and Office of the Data Protection Service.
For surgical trauma patients, access to safe blood and blood products determines whether they get to live. And that is why you should invest in Uhai's initiative.
So currently in Eldoret, there is an increased demand for blood and blood products. The reason you should invest in our initiative is to enable us to develop a minimum viable product, and this will enable us to venture into new markets, including the Great North Rift and the country as a whole. Thank you.
Because this is a very unique model driven by medical students and supported by academics.
Try to imagine an expectant mother in need of urgent blood to save a life. You'll not save the life of only the newborn, but the mother and all other patients in critical conditions. Thank you very much.